and surgical disorders. Mr. Speaker, this is an anti-discrimination bill. This is a health care bill. This is a pro-business economic development bill. This is also a pro-family bill, and this is a bill that supports our veterans. This is a bipartisan effort with 274 co-sponsors in the House, of which I am proud to be one. Unfortunately, federal action is necessary because Americans who suffer from illnesses like depression, postpartum depression, severe anxiety, bipolar disorder, and many other diseases are being discriminated against. You see, HMOs and many health insurance companies have been more focused on their bottom lines than on the health of our families. Mental health is just as critical to our lives and well-being as any physical ailment or disease. And yet health insurers continue to treat mental illness differently from physical illness. In America, more than 50 million adults, at least 22% of the U.S. population, suffer from mental health issues or substance abuse disorders. In addition, 1 out of every 10 children or adolescents has a serious mental health problem, and another 10% have mild to moderate problems. Untreated mental illness harms our families and children emotionally and financially. Untreated mental illness results in higher costs for businesses and lost productivity. Untreated mental illness often leads to criminal activity, which is very costly. Mental disorders are the leading cause of disability for individuals aged 15 to 44 in the United States. And a study sponsored by the National Institute of Mental Health revealed that mental and addictive disorders cost our country more than $300 billion annually. This includes productivity losses of $150 billion, health care costs of over $70 billion, and $80 billion for costs such as criminal justice. Unfortunately, less than 1/3 of people with a mental disorder who seek care receive adequate treatment. And despite the losses suffered in our society as a result of mental illness, and all of the studies that demonstrate this, national employer survey data indicates that mental health coverage still is not offered at a comparable level, comparable coverage to other medical conditions. Even after passage of the 1996 Mental Health Parity Act and all of the efforts of the states, the Government Accountability Office found that 87% of plans had more restrictive design features for mental health benefits than for medical and surgical benefits. In addition, many employers have adopted restrictive measures such as limiting the number of covered outpatient visits for mental illness. This is so short-sighted. It is so costly. Former Surgeon General Dr. David Satcher found that when health insurance plans unevenly impose higher costs for mental health services, the result, of course, is a reduction in treatment for those who need it, lost productivity, and higher costs in the long run. Dr. Satcher stated that this is a true issue of fairness in coverage. Similarly, another recent study found that deductibles and outpatient cost sharing were much higher for substance abuse than for general medical care. Well, this legislation addresses those inequities and provides a cost-effective way of providing increased access to mental health care. The bill prohibits discrimination by diagnosis by requiring coverage of all mental illnesses and substance-related disorders, just as we provide for members of Congress and others covered by the Federal Employees Health Benefit Program. Treatment for mental illness is a proven money saver. In fact, for every $1 spent on treatment, we save over $12. Mr. Speaker, we all owe a debt of gratitude to Mr. Kennedy of Rhode Island and Mr. Ramstad of Minnesota for their bipartisan leadership on this legislation and their work to provide for the mental health needs of our families, our neighbors, our veterans, and our children. We also owe great thanks to the Wellstone family, but most of all, we can't forget the families throughout America who have a modest request of their Congress, and that is that they be treated fairly. I reserve the balance of my time.